My name is Grace Atieno Jalango. I'm a clinical officer. Currently, I am in academia training students, clinical officer students, at the Kabarak University in Kenya. I have been in practice for over 28 years, initially as a general practitioner, but I went into clinical officer practice in diabetes care about 25 years ago. It's been a rewarding experience seeing the change that legislation policy has done in addressing the diabetes epidemic. We are not there yet. Systems in healthcare also have to be restructured if we're going to achieve greater impact. But so far, we have done well. One of the reasons why I'm excited about clinical officers in NCD care is that we have seen a greater role for providing NCD care that is accessible and more affordable. And this has widened the scope for the clinical officer or the PA, so to say. And the government, especially in my country, Kenya, has come to appreciate that the clinical officer is a formidable healthcare resource and can be trained to tackle diseases that initially that were thought beyond their scope once they're given proper training and systemic support. And I think Kenya is a good example of good or even best practice when this comes up, as we see more clinical officers engaged in non-communicable disease care, especially with diabetes as an entry point, and now other non-communicable diseases like cancer, hypertension, and cardiovascular diseases. The future is bright for clinical officers in Kenya. And mine is more to encourage, but even so, a greater commitment to capacity building, advocacy, and ensuring that policies are implemented to foster a favorable environment that not only ensures that we provide care for people with NCD, but that we prevent and promote health to avoid people getting non-communicable diseases.